Well, thank you guys for showing up. Like I said, we do these lectures. We try to do them every other month. So we're going to have a whole lecture series that we should be posting on our Facebook page. And it will be things like what we're talking about tonight. There'll be one on hormones. We're going to have one on fatigue, which we expect the room to be completely packed because it's probably the number one problem that we deal with here at the clinic. But a little bit about us. At Prairie Health and Wellness, there are 4 providers now, Sophia being our newest. There's myself, Dr. Marvin, and our 2 nurse practitioners, Jolene, and then Sophia is our newest one. So Sophia and I are sort of the family practice side of the team. Jolene's experience is years and years in women's health. And then Dr. Marvin really rounds us off with some incredible experience in lifestyle, as well as she heads up our lifestyle program, the New You, and then handles a lot of the patients who are getting some of the advanced therapies here, like the nutritional IVs and things like that. So a lot of things that we offer here. We are a direct care clinic, so we don't contract with insurance companies because we'd rather contract directly with our patients. And by cutting out that middleman, we can actually decrease our prices. All of our prices we publish on our website, so we want people. We think there really needs to be more transparency in the field of medicine. When someone needs something done, they should be able to say, how much is that? And there should be an answer to that question. So we work very hard to do that. So tonight, Sophia's going to talk about fever. So very excited. It's a topic we hear a lot about.
Thank you. So a lot of what we're going to talk about with fever will be geared towards pediatrics. That's where we got most of our questions, but most of everything can be applied for adults. So I'll give some adult versions too, especially when we start to talk about medications and the management of fever overall. So our goal today would be to define what is considered to be a fever. We're going to talk about why our body gets fever and what role that fever plays in our immune system and our immune response. And we're going to talk about how to treat fevers and when or why we would treat a fever. And then also talk about when we would call a doctor or when would be a good point to seek medical advice. So fever is any temporary increase in the body's temperature. So there's a lot of, just as anything with doctors and in the world of medicine, there's some variance in what people would define as the exact temperature at which your body reaches a fever. But the threshold overall is about 100.5 to 101 degrees. So that would be considered the beginning of a low-grade fever. A high fever would be considered 103 to 106 degrees Fahrenheit. And fever itself does not harm the body. So there was this interesting study where they went to 2 different pediatric urgent care clinics for 5 consecutive days, and they noticed that 31% of the patients were there because of fever. So they gave a survey to every patient and caregiver who was there for fever, and 93% of the parents or caregivers thought that a high fever could cause brain damage. They were so concerned and worried about it that 85% of them would wake the child up if the kid was sleeping to give medicine to bring the fever down. So we're going to talk through some of the reasons we would not necessarily want to interrupt sleep to give fever-reducing medication. So we'll go through that here in a few slides. So why do we get a fever? So there's a lot of things that fever does. The number one thing is fever can kill many viruses and bacteria, just the temperature itself. Most bacteria and viruses that invade us as humans, like that 98.6 degree average temperature that we have. So the elevated temperature itself can make an unfavorable living condition for bacteria and viruses. So the other thing that it can do is inhibit the growth and reproduction of bacteria and viruses. And there's multiple ways that it does that. One way is by lowering nutrients in the blood. So during a fever, we actually will reduce plasma iron, zinc, and copper. And those are minerals that bacteria in general need to reproduce so that they can thrive within our bodies. So during a fever, our bodies will actually shift our serum minerals so that we can prevent bacteria from replicating and growing. Another thing that fever does is initiate a further cascade of steps that will happen within our body's immune system. So it's kind of like the trigger effect. So fever pulls the trigger, and then our immune system can kind of start to go through a series of steps that are going to help our body with what invader may be causing the fever, be it viral or bacterial. The majority of cases of fever are related to illness and an invader. There are a few instances where our body can get fever where it is not related to a microorganism or bacterium or virus. When we talk about what the risks are of fever, some bacteria, when they die because of the high fever, will release endotoxins. And that release of endotoxins has an effect on our body. It can actually make us feel worse, and it can worsen our overall symptoms. So with fever in general, there will usually be symptoms associated with the fever, whether it's an upper respiratory infection and there's cough, congestion, sore throat, or GI symptoms where there's vomiting and diarrhea. Usually we have other symptoms that are associated with the fever. And when bacteria start to die off, those symptoms can be exacerbated or worsened, or we can get new symptoms. Dehydration is one of the biggest risks with fever, especially in the pediatric population. So it doesn't take very long for pediatric patients or children to become dehydrated. So really encouraging fluids and making it fun or finding interesting ways to do it. You can make slushies or popsicles, finding a fun cup or something that you can encourage them, and putting small amounts and doing more frequent, encouraging, like, can you just finish this small cup, so that you're pushing small amounts, and also kind of keeping an awareness of how much they've had to drink for the day. So being mindful of dehydration is one of the biggest concerns with fever. Hallucinations or delirium can happen with high temperatures. With kids, sometimes you can see that they're a little out of sorts when they're ill, or they may not make sense when they're talking. That itself is not concerning unless it gets to a point where the child is not behaving normal for a child. Febrile seizures is another concern with fever. That was the second reason that during that study with the pediatric urgent care is that people would give medicines to break a fever. They were worried that if they didn't reduce the fever, the child would have a seizure. And research has shown that fever-reducing medicines don't prevent seizures. So febrile seizures are pretty rare. They occur in about 4% of children, generally ages 6 to 5 years. In our next slide, we're going to talk a little bit more about febrile seizures. So there's some controversy in literature whether it's how high the fever is that causes the fever, or whether it's the rapid change in temperature, so how quickly our body gets to that fever. And so the literature that I found is that it's more that quick increase in temperature that increases your risk for fever. Antipyretics, or medicines that prevent or reduce fever, do not prevent your risk for febrile seizure. Generally, if those who do have febrile seizure do not suffer any long-lasting effects of the seizure. And children who have parents that suffer from a seizure disorder are more likely to have febrile seizures. So when we think about some of the reasons that we want to reduce a fever or lower a fever, it isn't necessarily going to help prevent febrile seizures, and we know that there's no risk in brain damage. So then when we start to think about why would we give a medicine to reduce the fever, in what situation would we think reducing the fever can actually help the patient? So medications should be used to help prevent worsening of the side effects of fever. Like we talked about, the number one with kids being dehydration. So if the kid, or even you and this adult, if you're so uncomfortable that it's hard to drink or eat or just function, then having a medicine like ibuprofen to help make you comfortable, and that will also reduce the fever. We don't recommend acetaminophen, and there's several reasons for that. So here in the U.S., on drugwatch.com, Tylenol, or acetaminophen, the main ingredient of Tylenol, is considered the number one reason for acute liver failure here in the United States. So Tylenol is very, very hard on our liver, and that obviously acute liver failure is with repeated exposure and repeated doses. But even just one dose of Tylenol can deplete glutathione, and glutathione is one of our body's natural antioxidants. So when we're sick, we need glutathione to be helping us not fight or dissolve the Tylenol, but to actually help take care of the bacterium or virus that's causing the illness. There's even some literature that associated women who used acetaminophen during pregnancy had a higher risk for children who would develop a spectrum disorder like autism or attention deficit. So there's some literature that supports that as well. One of the things that we forget when we think about keeping our kids comfortable, there's a lot of non-medicine things that we do, what we call non-pharmacological. So giving the kid a blanket, letting them cover up. Sometimes, I know when I was little and I would have a fever, my mom would say, I would be cold. You know, you get fever and you get chills. It's your body's way of wanting to warm up. And she'd say, you can't have a blanket. You gotta, strip you down, and you'd be sitting in your underwear just shivering. It's okay to cover up. It's okay to keep the kid warm. It's encourage rest and sleep. So sometimes when we have a fever and we don't feel like doing anything and resting and sleeping or lying around the house, that we lose our energy, and that's okay. Our body's going to be using our energy for other reasons. It's going to be using our energy to help fight, the bacteria or virus that's inside our bodies. So resting and sleeping can be helpful. Drinking plenty of fluids, water, coconut water, electrolytes. We also, and I'll come to another slide where we talk about vitamin C. You can add that to water, and so that can help in multiple ways. And like I said, making slushies or, making popsicles, finding fun ways to encourage fluids. Another great medication, or I should say supplement, curcumin. So we have Curcumivale. It's a supplement that we use as an anti-inflammatory. It helps with general aches and pains. So aches and pains that would be associated with fever or illness. And curcumin is actually very immune supportive. So it helps our immune system function better. So using something like curcumin that will not break a fever, but it can provide comfort and it can also help support the immune system would be a great choice over something like Tylenol or ibuprofen. So when it comes to supporting the immune system, so the whole reason we get the fever is because our body is trying to take care of an invader, bacteria or virus. So our immune system and that cascade of events that are going to take place after we start that fever can be supported. I think of it, I use the analogy, it's like your body is at war and your immune system are little soldiers who are out there fighting this war against the invader. And doing things that support our immune system, it's like giving them ammunition. So, our body needs this fuel and all of these natural ingredients to help us fight the war against whatever it is that is making us sick. So high doses of vitamin D3. For the pediatric population, we generally dose 1,000 international units for every 10 pounds. So if you had a 50-pound child, you could give 5,000 international units. And you would do that high dosing for 5 to 7 days. So we wouldn't do that long term, about 7 days max for the high dose of vitamin D3. For adults, most adults, you could do 50,000 international units a day for 5 to 7 days. Probiotics are really important. We recommend probiotics every day for everyone. Just the way that our diet has changed here in America, we really aren't getting those nice fermented foods that our older generations used to get with the overuse of antibiotics and antibacterial soap, and there's just several reasons that our gut health or our good bacteria just aren't what they once were. So probiotics are really important, and 70% of our immune system is in our gut. So when we think about supporting our immune system, making sure that we've got some healthy human strain bacteria or in our body is going to help our immune system. When it comes to picking out a probiotic, Not all probiotics are created equally. One thing we recommend is if you buy a refrigerated probiotic, that once you open it, you leave it out of the refrigerator, because bacteria are hibernating or they're asleep, and when they're in the fridge, they're asleep. When we take the bottle out and we open it up, air gets in, and when we close it and put it back in the fridge, that air turns into moisture, which wakes up the bacteria. Well, then the bacteria are alive in your probiotic bottle instead of when you ingest them in your gut. So making sure that you're watching those kinds of things. Look at the shelf life on your probiotic, and also the count. So depending on what you're using probiotics for, a general dose would be about 15 to 30 billion count.
So even if it says to take it and keep it in the fridge, once you open it, leave it on the counter?
We would recommend to leave it out. It's more likely that the bacteria will stay hibernating in a dry, cool environment. So, maybe in the back of a cupboard somewhere where they're not going to be exposed to heat or the sun, as opposed to putting back in the fridge and having that moisture go into the bottle. We also have a great supplement called Immunotone Plus or Immunoberry. Immunoberry is a liquid that's great for kids. It has elderberry, it has beta-glucans, it's got a nice mushroom blend, so it's got lots of ingredients that help our immune system. In the adult version, the Immunotone Plus, it has echinacea in it also, and I think it has golden seal root and green tea extract, so just a lot of really immune supportive things. And with the Immunoberry for pediatric patients, you could give 1 dropper full 3 times a day. So that's something that you could do frequently. Again, our body's working really hard to fight this infection, so it's not 1 dose and done. We want to continue to support our body while we're going through this immune process. With both of those supplements, those are also short-term. You wouldn't want to use those more than 10 to 14 consecutive days with that type of dosing, or even in general, just because we don't want to stimulate our immune system when we're not ill. N-acetylcysteine, or NAC, it's got a couple of really great properties. One, it can help thin secretions or mucus. So when we have upper respiratory infections, the cough, the congestion, it can help thin the secretion so it's easier to cough up, and it makes the congestion less severe. And it's also a precursor for that antioxidant that we talked about, that glutathione. So glutathione is going to help us, protect us from our environment, from environmental stressors, and also from invaders like viruses and bacteria. So N-acetylcysteine can help our body convert to making glutathione. There's a few other things our body needs to do that, but N-acetylcysteine, or NAC, is one of those great ingredients that helps us make glutathione. Vitamin C, so we talked about, actually we didn't, oral vitamin C. So when it comes to oral vitamin C, high doses during illness can be very effective. So vitamin C creates an oxidative environment, and oxidation for unicellular organisms, or simple bacteria or viruses that are really simple beings, just one cell, they don't withstand that oxidative environment very well. And we have special enzymes in our body that will protect us from oxidation, and we're complex beings, so we can tolerate more than a bacteria or virus can. So doing high dosing and frequent dosing of vitamin C can be very helpful. When it comes to oral vitamin C, we recommend powder form. If you can't get powder form, then capsules. We really don't recommend tablets. We really don't recommend tablets of anything, just because tablets are highly compressed. So our bodies really can't break it down and absorb all of it. Dr. Davis can attest to it. He does colonoscopies, and it's surprising sometimes that all the way down in the colon, there'll be whole tablets that he can read the inscription on them, where they haven't dissolved or absorbed.
I've got an even better story, but we'll have to wait till we turn the video off.
So you said tablets and powder?
I would do powder or capsules, but powder is going to be the easiest for your body to absorb.
Isn't it only like 15%? It's a water-soluble vitamin, so only 15% of the dose is actually absorbed.
So you're going to urinate most of it out. And another factor that you want to consider, because of that low bioavailability when you drink it or consume it through the mouth, is that if you take too much at once, it can cause GI upset. So you can have an upset stomach cramping. You can have an urgent loose bowel. I don't like to use the word diarrhea because it really is just kind of a one-time stool to get rid of it. So that is just kind of a sign that maybe you should slow down. So we have a supplement called Immuno C, and it has 2.5 grams of vitamin C in 1 teaspoon. So I mix it in my 20-ounce blender bottle, and I sip on it over about an hour or two so that it's just slowly in the system. For adults, you can shoot for 10 grams of vitamin C during illness. Vitamin C is also very supportive of vascular health. It is also supportive of our adrenal glands. So for those of you who do have fatigue, like Dr. Davis was talking about, it can help support your adrenal glands. So there's a lot of really good things for vitamin C. When it comes to kids, depending on their size and weight, we wouldn't want to go up to 10 grams for smaller children. So, maybe 2 grams for their daily dose, or 3 grams depending on their size. And again, dosing very small amounts throughout the day and sipping slowly. And one of the things you can do is make a vitamin C slushy or popsicle like we talked about. And that's why, that point you brought up about bioavailability with vitamin C, we have IV vitamin C. So research shows that IV vitamin C is 70 to 75 times more bioavailable than the oral vitamin C. So that's pretty significant. So when we're doing high doses through the vein with such a high increased bioavailability, it really is that much more immune supportive. So we use vitamin C for acute illness, like you get the common cold or the flu, and we can also use it for chronic illness, so patients who are suffering from mono or other viruses that are long lasting. And then we have IV glutathione. So glutathione is another one with supplementation where it's not very bioavailable when we take it orally. It's hard to get it absorbed. We use a liposomal form of glutathione that increases absorption, but when we do intravenous glutathione, it really does make a difference on the bioavailability and how much of it is being absorbed in the body. So then we go into when to see the doctor. So some of the things we want to think about is fever for more than 3 days, especially if you're not using anything to break the fever and we're letting the child fever and they're doing well with their fever, eating and drinking well. If there are symptoms associated with it, cough, sore throat, and you can see the cause of the fever, during those 3 days, if there's no progression or improvement in those symptoms, then you might want to see the doctor to see if there's something else going on. If the symptoms are starting to improve, then it's a sign that the immune system is doing what it's supposed to do, especially if the child is starting to get energy back, they're drinking and eating well, playful, maybe still resting a lot. It's a sign that their immune system is doing what it's supposed to and that the kid is starting to probably improve in symptoms. Signs of dehydration. So that's a big one. That's probably the number one reason we would want to see a patient, especially a pediatric patient who had had a fever, if they start decreasing their fluid intake and you start to see signs of dehydration. So some of the general symptoms would be, just irritability or fussiness, but you'll notice a decrease in urine output. So less changing the diapers, less using the bathroom. Sometimes there's a higher concentration of color in the urine because there's not as much water being urinated out. Sometimes it's got an odor to it. You can smell because it's more concentrated. Also, kind of sunken eyes. You'll see like the dark circles or just kind of sunken in eyes or cheeks. Skin turgor. So, most of us, when we pull our skin up, it's going to snap right back. For the older population, when we start to get dehydrated, if you pull your skin up and it's kind of sluggish to fall back, that's a sign of dehydration. The oral membrane, so our gums are usually nice and pink and bright and shiny. When we start to get dehydrated, they kind of will turn pale pink, they'll be dry, no tears when the kid's crying, not having any tears come out. Those would all be signs of dehydration. And signs of dehydration would be an absolute indication to see a medical provider. Excessive fatigue or lethargy. where the kid, or even as adults, where you just absolutely have no energy and you have a hard time thinking or functioning or doing things. Kids that are inconsolable, so you've tried everything you can to comfort them and they're not getting comfortable, that would be a reason to seek medical attention. And then worsening of symptoms with no relief. So the symptoms continue to worsen, or new symptoms are developing. It's not uncommon when we have one infection and our immune system is at work for us to get a secondary infection or a co-infection. So bacteria and viruses are opportunistic, and if our immune system's tied up, fighting one battle, they'll sneak in the back door, and then it's, easy for you to get a secondary infection. Some patients will say, yeah, I started out with this cough and congestion, and then it turned into, the stomach flu, and, that's a sign that, there were probably 2 different infections going on at the same time. Okay, so any questions about fever or when to treat and how to support our immune system?